Is knee pain affecting your quality of life? Well, something revolutionary in treating joint pain and discomfort is here. Willo MD. Willo MD is an easy-to-use mini computer that scans, computes, and treats safely, effectively, and easily with the use of 100% natural science. Willo MD is developed by physicians, is F.D.A. compliant, and uses patented medically validated technology to relieve pain and promote healing with no adverse side effects, and the results are guaranteed. When applied to an affected area, Willo MD uses a combination of photonic and thermokinetic energies driven by a mathematical algorithm to calculate, then immediately deliver, customized treatment and relief. The patented treatment platform, known as non-invasive neurovascular stimulation, is an exceptionally advanced bioelectric system that uses the same photonic and thermokinetic energies to stimulate receptor sites in a way that is proven to relieve pain, increase mobility, and accelerate healing and rehabilitation.
My name is Jason Romano, former Major League Baseball player for the past 12 years. I got introduced to the Willo MD about a month ago, and it's really helped me with my knee pain. Through my career, I developed some serious patella tendonitis and never could find any product out there that helped with that pain and that soreness every time I bent my knee. And I found the Willo MD, I put it on my knee, and within 30 minutes, I got up and I was pain-free. It was one of the most amazing things I've ever seen.
Injuries that I sustained playing college and high school hockey. I've been having physical therapy on my knees. I've had episodes where I've had colleagues inject and drain my knees. Over the past 5 years, I've had 2 knee operations, one on each side, which helped for a short period of time, but because of the amount of wear and tear that my occupation as an ER physician occurs with my knees, that the pain has become relatively constant. Over the 12-hour shift on a busy day, we can walk 10 to 12 miles, which really will, over a period of time, wear your joints out. 4 or 5 days ago, I ran into Dr. Ron Shapiro, who does pain management in our emergency department, and we used a device on my knee, which the results were just absolutely incredible. I went from less than 45-degree flexion to over 90 degrees. I've been able to walk without pain. Over the past weekend out on the golf course with the dog in the heavy snow, which would just absolutely tear my knee apart, and I have absolutely no pain. I just found out before the interview that the name of the device is the Willo device. I actually hadn't heard of it before I used it. Was cynical actually while I was using it. And I'm just really amazed at the results that I got from it.
Joining me this afternoon is collegiate women's basketball coach Barb Smith, who's going to share her experience with the Willo MD.
2 years ago, I was, and I'm an avid runner, but 2 years ago I was diagnosed with some tears in my Achilles, and all they told me was to give it rest and to stay off it as long as possible, and that it would take a long time to heal. And I came upon the Willo about 1.5 years into that situation, and I had not seen a whole lot of improvement before that. Tried a lot of different things, and then eventually I tried the Willo. And you know, the first couple of times I didn't own it, so I was borrowing it and using it one time here, one time there, with not a whole lot of relief. But then I decided to actually buy one and commit to using it. And so what I did was, I would use it every single day, a couple times a day, back-to-back sessions. And within a couple of weeks, I started feeling some major relief. And so then I continued to use it religiously pretty much every day, and in a very short amount of time I'm back to running every single day, 30 minutes. I'm up to 30 minutes of running, and after 2 years it's such a huge relief to be able to run again. So I'm extremely happy with the progress and then the fact that it got me back on the road. I'm a fan.
Okay, thanks Barb. We appreciate you sharing your story.
Hi, we have Ron Shapiro, president of BGM Group today. He's going to tell us about his experience with the Willo MD. Good morning, Ron.
Hi, how are you today?
Good, how about you?
Good. Well, I've had a very positive result with the Willo MD. I have a torn rotator cuff in my left shoulder and experienced a lot of pain if I tried to move my arm back behind my body in any way. Used the Willo MD, and now, as you can see, I can reach back pretty good. I still know that I have a torn rotator cuff, but the pain is so reduced it's not affecting my life or my golf game, which isn't any good to begin with, but I've had a very positive result, and it seems to have a residual effect because I only use it about once every 10 days to 2 weeks, and it takes care of the pain, so good thing.
That's great. Glad to hear the good news. Thanks a lot, Ron.
So what did you think of the Willo MD device?
I think it's very good. I definitely have better flexibility.
Mm-hmm.
A lot of the things that get in the way, of course, again, are the scar tissue back there that limits me. But all in all, my knee feels good. The swelling has gone down.
Feels looser too?
It feels looser. I can squat a little bit, which I couldn't even do before.
Mm-hmm.
I mean, great. I think it's a wonderful thing. If someone had that all the time, I mean, you could really feel good.
Mm-hmm.
Definitely.
Okay, thank you.
Hi, Carol. How are you?
I'm doing really good today.
I understand you tried the Willo MD yesterday here in Orlando.
I did, and I have to tell you, I'm so pleased. I had it here on my neck and my shoulder for like 24 minutes, and prior to that, I had about a little bit this range of motion, and now look at me, I can turn my head all around, and I have no pain, which I used to live every day with pain. Normally I took, I don't know, maybe anywhere from 10 to 12, don't tell anybody, Advil and Aleve and aspirin every day because just to manage the pain. And I have not had one single one since I have used the Willo, and I'm so pleased.
Well,
I can't remember now what it's like to have that. So it's really great. So I love the Willo.
great. Thanks for trying.
Thank you.
Congratulations on your Willo MD, and welcome to the Willo family. You know, the Willo MD is the result of many years of research and development. The technology has been extensively tested and validated in clinical and hospital settings. For the best result, our physicians recommend following these simple steps.
Step 1. Lightly grasp a chair with your fingertips. Bend your knee slowly and stop when you first sense pain. This is your beginning range of motion number. Select the icon closest to your number and record it on your patient log that was included with your Willo MD packaging. Next, record your beginning Willo MD pain scale number on your patient log. Step 2. Apply your Willo MD to the skin surface of the painful knee joint below your kneecap with the strap that was included in your packaging. Make sure your skin is dry and free of lotion, ointments, salves, or topical preparations. Press and hold the power button for 2 seconds. Select in acute or chronic mode. Slightly elevate your leg and relax for the 25-minute treatment session. Your Willo MD will beep 1 minute before your treatment ends. Step 3. Following the end of your treatment sessions, record your measurements as in Step 1 and compare them with your beginning numbers. A complete instructional manual is available to registered users and includes all features, directions, and questions you may have.